I'm Dr. Gary Ridenour. This is my invention. It's called the Med Sheet. I'll take this out so you can see what it actually looks like. And that would be basically the front of the folder. You open the folder up and you have a medication list. You have your numbers. Also in here will be release from responsibility. And the reason we do a number system is because 50% of our patients do not take their medication as prescribed. It costs $317 billion a year, unnecessary emergency room visits, hospitalizations, and getting different medications to correct the problems that they have generated. 69% of the problem with medication is due to forgetfulness. And this little sheet will be with you. And 16% is due to the cost of the medication. They won't buy them. 15% of the problem is due to the fear of the medication and the side effects it will generate. Now, what we do here with this system is you've got a medication. You can't read this anymore. So you put a 1 here, okay? And then we take another 1. We put it there. So we have a 1 here, a 1 here. Then, for number 1, we write the medication's name, the dosage, how often we take it, and we talk with our doctors to get the reason we're taking it. Then we move on. We put a 2 on here. And a 2 in the gap out here. So we're not covering up anything that the federal government wants on here. So we've got a 2 and a 2 now. Then we go for our 3. And peel off the other 3 if I can get it off. There we go. Very quickly. And once again, we put it out here in nowhere land. And we got 3. So now we have 1, 2, and 3. So you can see that right on the shelf, you got your medications. And you have the medication name and the dosage and what numbers they are. So we can call into the doctor's office for a refill. You call in and go, I need the refill number 1. The nurse or medical practitioner will call back and verify the name of number 1, and they will refill number 1 for you. Now, when this list is filled, and you got these numbers, you bring them into the doctor's office. The doctor or the nurse check the names and the numbers against the list, make sure all the columns are correct, and then they make a copy of this and put it into their system. You could scan it into your computer system if you got it, or if you're still on paper, you can just put it in your paper system. From now on, you and the patient have the same list. So they don't have to bring in bottles anymore because they forget the bottles. They don't know where they're at. So they can bring them in this way, and it's organized. The other thing is, they'll get a card, medication times. So let's say 8 a.m. they take 1, 2, 3. So I put a 1, 2, and 3 here. At noon it's a 2, and dinner time is just a 3. So now they have a cheat sheet for when to take their medication. Also in this package will be cards, questions to ask my doctor. So you can write down what you need to ask your doctor and take your card with you. In fact, what I suggest to my patients is that they bring in the entire thing every time with them so they can make notes. They don't have to bring these anymore. The other thing is that if you get sick and the paramedics come, they don't have to grab these and run around grabbing all the bottles in the house. Instead, they just take the medication sheet in with them. On the back of the medication sheet also will be past medical history, drug allergies, and emergency contacts. So that's all they'll take. And then if something changes in the hospital, they can change them when you get home again. And basically that's about it. I really hope you enjoyed my little short video, and we'll go from there. Thank you.